So thank you so much for doing this interview with Disability Rights Louisiana this morning as part of our series to inform people with disabilities about issues that relate to them. So first, before we get started, can you just introduce yourself and your district and anything else you'd like to add?
Sure. Yeah. Thank you so much for having me. My name is Bob Murrell. I am running for District A for the New Orleans City Council. A little bit about me. I was born at Charity Hospital 40 years ago. I grew up here in New Orleans. I went to public schools, graduated from Riverdale High School, and then I attended Tulane on scholarship to study computer science. And then Hurricane Katrina hit in between my sophomore and junior year, kind of changed the trajectory of my life. But afterwards, I was able to to continue schooling, and then eventually got a job in the software industry where I've been a team lead, a senior engineer, and now I'm a project manager for the last 15 years in the software industry here in New Orleans. I'm also a grassroots organizer and community leader in a variety of different organizational spaces, including New Orleans DSA. And I'm a parent of two young children, a working parent, and I currently live in Lakeview with my wife.
Sounds great. So, for my first question, what steps would you take to make New Orleans infrastructure and public spaces more accessible to all residents? And how would you ensure that residents with disabilities are at the table when decisions are being made about the city's built environment?
Thank you. Yeah, it's a great question. So a lot of things when excuse me, when we talk about accessibility, some of the first things that comes to mind is obviously mobility, right? Having sidewalks and pedestrian traffic that's accessible to everybody. I know that when I worked in the CBD for a little while, this must have been like 10 years ago. One of the challenges that I had as someone who, does not have mobility issues was trying to navigate just the sidewalks around the CBD because of the amount of road construction that was going on that was blocking sidewalks, blocking streets. And obviously, we're just talking about a narrow focus of what accessibility means here in New Orleans, but it's one of the most prevalent ones because there is no real freedom to move in New Orleans, right? So for me, I always put an emphasis on universal equal access, right? So when it comes to accessibility, it's making sure that we have that frame of reference. In the software industry, accessibility is a big part of what we do, both in terms of usability of the software, but also legal requirements, right? To make sure that software is accessible to all people. And I think that that's a mindset that I will definitely bring to governance, whether it's talking about our availability of resources, whether they are online or in person, to make sure that we are able to get all people that may or may not have the same accessibility that we take for granted sometimes, but also making sure that, like I said, when in terms of our infrastructure, that we are prioritizing people to have accessibility requirements for all of our transit, whether that's on sidewalks or in roadways or on our public transit as well. And to answer the last question about bringing in people from your community, like I said, I'm a grassroots organizer. So everything that I do is about expanding democracy, right? Making sure that we are all equal participants as best as we can be. And that means meeting people in their spaces, right? So coming to groups that are having a focus on accessibility, making sure that they are being not only just represented, but actually have a voice in what's happening. I feel all too often city council is kind of a one-way street, right? Things get decided and then we're informed of it, right? That's not how I operate. I'm here to flip the system, right? I want to make sure that people are bringing their demands, bringing their needs up to city council, and it's city council's job to remedy that so that way it's done again in a way that's fair and democratic and participatory.
Thanks. So, how will you support economic opportunities for residents with disabilities, and what steps would you take to ensure that jobs across the city are truly inclusive and equitable?
Yeah, thank you. So there was recently the Workers' Bill of Rights. It was an amendment to our city charter that passed pretty substantially, popularly. I think it was like 80%. And that was a way of us as a city to say these are the things that we value, right? And when it comes to workers' rights, accessibility and protecting people with disabilities is part of that, to make sure that everyone has an equal opportunity to have a living wage that takes care of their needs, that they are able to receive medical care benefits to make sure that they are protected. But I think most importantly is that we are not allowed to discriminate against people based on their accessibility or disability. So I think that that's important, that number one, we're enforcing these rules, right, to actually give them teeth. So as a member of city council, that's something that I prioritize, to make sure that we're, number one, making sure that businesses are aware of these rights that they should be giving to their employees and enforcing those rights. There's also a movement from Step Up Louisiana, who is one of the primary organizers of this movement, to make sure that we are able to offer sort of like a health system, right? So like you have with restaurants, this is a rated A restaurant. It's, food safety is important here. The same could be said for workers' rights. And so trying to create a scoring system where if you're looking for a job and this company is rated, a D for workers' rights, that can certainly try to incentivize that employer to work better, to actually provide equitable treatment for all their employees. So that's something that I think is very important for me, is ensuring that all people, regardless of their circumstances, are able to have livable wages, good benefits that take care of their own personal needs that they have, whether they do have physical disabilities or not. And most importantly, to make sure that we're treating them as human beings, right? That is first and foremost. And when it comes to the city contracts, I do believe that the city has not done an adequate job when it comes to city contracts to make sure that we're making sure that, again, that employers are taking care of the employees to the living standards that we have. There's supposed to be requirements that we've seen get circumvented by having subcontractors, right? So if there's a livable wage for, say, road work, and that road work company subcontracts that out to a secondary company, that secondary company is not meeting those standards. So I want to make sure that we close that loophole, and to make sure that all people that are receiving city money should be following the rules of the law of the city. And if you're going to subcontract that out, that those people are also still being held to the standards. But ultimately, we need to try to reverse course, right? We need to start trying to bring those back into the city. The city does have the ability to set a livable wage, right? We can't set a minimum wage right now in the city. So if we're able to bring in more people as city employees, it provides a lot more opportunities, number one, for wages, having a union, which is pretty critical in taking care of people's rights, giving them representation in the workplace, and most importantly, oversight, and making sure that we are able to make sure that these rules are being followed.
Great. And what is your vision for ensuring that residents with disabilities can access safe, affordable, and accessible housing across the city? And how would you address both affordability and physical accessibility in your housing policies?
Great, thank you. So housing justice is one of the things that I organize around outside of election cycles. Obviously, the formation of the Housing Trust Fund was a big movement towards actually putting government dollars towards fighting this affordability crisis that we're having in New Orleans here. So I think most importantly, it's well founded on my campaign platform, is making sure that number one, we have a rental registry, right? We're making sure that healthy homes standard that was passed is actually being enforced. Number two, that we're making sure that residents that need housing are able to find the housing that they need in one place. And if you are someone who has housing that you want to give, that you are also able to find good tenants that are able to live in your property, and that you can have that income that you need. Obviously, when it comes to things like short-term rentals, or in parts of District A, they have the doubles to dorms, where we're seeing good housing stock being taken off of the market, either to have as just, vacation rentals for tourists, or even worse, for subdeveloping into these tiny little dormitories just for student housing that flip every 6 months. Commodified housing is something that I feel is ruining our city right now. It is taking something that people need to live and turning it into a profit generator. And that to me is incentivizing bad faith actors, outside investors that don't live here to come in, take our housing stock, and make money for themselves at the expense of people here in New Orleans. So I think number one, making sure that we're enforcing healthy homes, that we're utilizing the housing trust fund to actually house people and keep them housed. And most importantly to me is setting a standard, right? I believe housing is a human right. Healthy housing is a human right to make sure that we don't live in moldy places or that are inaccessible to our needs. So zoning is obviously one of the oversights that a New Orleans City Council has, and utilizing zoning to make sure that we are meeting accessibility requirements is critical. Whether we're talking about new developments or even getting licensing to get permits to fix up housing. Ultimately, we need to make sure that any type of rehabilitation or building that we're having with housing is meeting certain standards, whether that's for affordability or protecting people with disabilities.
Great. How would you work to expand access to mental health care in the city? And what role do you see the city playing in preventing incarceration of people with mental health conditions?
Yeah, it's an excellent question. It kind of hits home to me because I've had family that have mental health crises events, and making sure that they are not being, kidnapped by cops in this moment, but instead of receiving the correct care that they need. I was an advocate for the Help Not Handcuffs campaign that happened about 4 or 5 years ago to create a mental health response unit when people call 911 about mental health crises events, and continue to advocate to make sure that we are not sending armed agents of the state to places where they don't belong, right? And one of those is when people are in need of mental health care rather than handcuffs. I think one of the ways that we can do that very easily, I say easily, but it's not, is expanding our health department in the city of New Orleans. Dr. Vegno has been an outstanding leader of the health department. Obviously, she's shown her capacity as a leader and an inspiring person during the COVID crisis. But additionally, she has been trying to step up when it comes to making sure that we're able to give adequate mental health care to people that are in need, whether they are housed or unhoused, whether they, are long-term residents or short-term residents. And I think it's important that we realize that the health department has scaled down significantly over the last 20 years. And we're in this crisis right now where people are being forced out on the street. People are experiencing all kinds of different health issues. And it's critical for us now more than ever that we start taking care of people. So for me, expanding the health department, bringing in as many people as we can to augment existing services, whether that's bringing in more social workers or CNAs, any type of clinician that is able to provide the resources that we need to take care of people, I think is critical. Whether that's opening up new facilities or clinics in neighborhoods that are being underserved, or just, like I said, augmenting services that do exist with actual city resources.
And this is my final question, but how would you advocate for more equitable access to Medicaid and other healthcare supports for New Orleanians with disabilities? And what types of policies would you support or oppose?
Yeah, so I believe in universal healthcare access. I was a proponent of Medicare for All when it was in vogue, and continue to advocate for people having the ability to receive the care that they need, whether they can afford it or not. We obviously live in a state that continues to devalue and attack the Medicaid program. So I will use all the resources that I have available that are limited in scope to continue to advocate for the protection and expansion of Medicaid, and to make sure that we are um, being able to distribute those resources, like you said, equitably. I think one of the challenges that we see so often is educational resources. My mother-in-law, she's retired, but she did work in hospice care. And so for her, making sure that people know what they have available, making sure that they know their rights, a lot of it is just through education, right? So making sure that we are educating our seniors, educating our people that are on fixed income and disabilities, and making sure that they know their rights, that they know what resources they have available to them, and finding the areas of like I said, plugging in the holes with whatever city resources that we can put into place. One of the things that I like to talk about is in order to make sure that we can distribute things equitably, we need to have a better stock on data and collection and making sure that we're aware of the people that are receiving benefits so that way we can find the gaps to close. And so for me, I'm all about data and transparency because if you don't know it, you can't have oversight. So for me, I really want to make sure that we're continuing to plug all the plugs together when it comes to our data, whether that's coming from the city department, whether that's coming from nonprofit partners, or even from our hospitals that are around town, to make sure that we are able to have one centralized place that we can effectively distribute aid and making sure that we're filling in those equity gaps where they arise to make sure that we're not underserving people. And again, that starts by knowing who's being underserved. And so having adequate transparency and proactive data collection is pretty important to that. But for me, like I said, I support having universal health care and making sure that all people have access to it. And at the end of the day, that requires the political willpower to stand up for that. And I certainly have that.
Great. And before we end this call, is there anything else that we didn't cover that you'd like to add?
Not off the top of my head, no. I think that I'm very grateful that y'all are advocating for, I think, what is critical, right? A lot of people in New Orleans feel underserved because of their circumstances. But ultimately, a lot of the circumstances that people have, whether we're talking about within the Black community or the elderly community or young people or people with disabilities and accessibility issues, these are all the same struggle at the end of the day, which is we're fighting for a fair and equitable society and a New Orleans that serves everybody. And that to me is why I'm in this fight, right? Is to make sure that every single child, every single adult, every single person in the city is able to live to their fullest. There's that it's starting to become trite now of thriving, not surviving, right? We've gotten to the point where survival is tied to this concept of resiliency. And we see it a lot, with the anniversary of Katrina coming up. And to me, as someone who grew up in the city, who was here for Katrina and who came back, I find that resiliency is just the human nature of living in our capitalist society right now. And at the end of the day, I like to use the slogan "People First." It's more than a slogan; it's a motto, right? For me, I'm always wanting to look to make sure that we're taking care of people before we're trying to get profits for businesses. I want to make sure that we're taking care of people before we're worrying about property. And at the end of the day, that comes from a moral and ethical grounding that I have, and I will continue to have, which is in service of all people here in New Orleans.
Thank you so much for your time today and best of luck on the campaign.
Thank you so much. It's a pleasure chatting with you.
Have a nice day.
Thank you.